Hand if you have your driver's license. Now raise your hand if when you got that license they asked you if you wanted to be an organ donor. Do you remember? So almost everyone raised their hand when I asked that question, and everyone who has their license gets asked if they want to become an organ donor. This means that almost everyone has to make this decision in their lifetime. Before I was born, my uncle got sick with stage 3 cirrhosis. Within 9 months, he received a partial liver from a deceased donor. I am very thankful that someone was kind enough to donate their loved one's organs, because without it, I may have never gotten to meet him. I encourage everyone to become an organ donor because you could save someone's life one day. To understand why you should be an organ donor, I will first explain the organ shortage crisis, what causes crisis, and some possible solutions to help. There is a huge problem in the U.S. with organ donation. This problem is that there is a nationwide shortage of organs. There is not enough donors to match the people on the transplant waiting list. According to Elizabeth A. Pomfret in an article, Solving the Organ Shortage Crisis, on online library-com.serena.ucmo.edu, dated February 5, 2008, organ transplantation has in some ways become a victim of its success. Within 30 years, the supply of organs has not met the demand. The gap widens every day, and the number of people on the waiting list increases. According to Health Resources and Services Admin, on their website, Organ Donation Statistics on organdonor.gov, dated September 2020, it stated that every 9 minutes, someone new is added to the transplant wait list, and only 3 in 1,000 people die in a way that allows for organ donation. There is an increasing number of people dying on the wait list due to lack of donors. Elizabeth A. Pomfret stated in an article, Solving the Organ Shortage Crisis, on online library-com.serena.ucmo.edu, dated February 5, 2008, that the number of deaths that occur on the waiting list is almost the same as the number of transplants performed each year. According to the Health Resources and Services Administration, on their website, Organ Donation Statistics on organdonor.gov, dated September 2020, they noted that 17 people die waiting for an organ on the list each day. There are many things that happen that cause this problem in the U.S. The main one is simply that there are not enough donors to match the number of people on the transplant waiting list. Some of these causes pertain to the medical side. Organ donation is offered to a huge population of patients with high success rates. Improved surgical techniques and transportation technique advancements have also increased the demand. According to the Health Resources and Services Administration, on the website Organ Donation Statistics on organdonor.gov, dated September 2020, that as of September 2020, there are 109,000 men, women, and children on the waiting list. And in 2019, only 39,718 transplants were performed. The demand also increases from lifestyle factors such as increased life expectancy, obesity, diabetes, alcohol-related liver failure, and metabolic disease. Another cause is the opt-out program the U.S. currently has in place. This is also called explicit consent. According to Ghazi Ahmed and Sadia Efkatar in their article, An Analysis of Organ Donation Policy in the United States, on web.a.epscohost.com, dated May 1, 2016, they stated that less than 1/3 of the U.S. population are organ donors with the current method. According to the Health Resources and Services Administration, on their website, Organ Donation Statistics, on organdonor.gov, dated September 2020, they noted that 90% of adults support organ donation, but only 60% are actually donors. The last and final cause is how little the public knows about the organ shortage crisis. Todd Zilwich stated in his article, USA Confronts the Looming Organ Shortage Crisis, on web.a.epscohost.com, dated August 12, 2006, in an interview, Sattel said that she gave organ donation issues no thought, before her own kidney failure resulted in a successful transplant in March. I think that this issue is true for most of the population in the U.S. No one really gives the issue a thought until they affect them directly by affecting them or a loved one. There are very few programs in place to inform the general public about the issue, meaning that there's a lack of basic knowledge and understanding about organ donation. Usually, the next of kin has a say in what happens, so people should discuss if they would like to be an organ donor with their family. Since there's a prominent cause, there has to be some possible solutions to turn this crisis around. Experts have come up with many different solutions, including some basic and some complex, and with implementing these, we can help the organ shortage crisis. The biggest solution to help is turning the U.S. policy from explicit consent to presumed consent. Currently, the U.S. has explicit consent policy, which means that everyone is not an organ donor unless they specifically say and take legal action to state that they are. Presumed consent is used in many other countries, and it is the exact opposite of explicit consent. Everyone is an organ donor unless they take legal action and state that they do not want to be a donor. They have tried to introduce this into legislation before, but it was shot down. If it was implemented, people feared that it would interfere with political and religious beliefs. Presumed consent proved to work with several other countries where it was implemented. Spain, Austria, Hungary, Poland, and Sweden all use presumed consent. Ghazi and Sadia Qatar stated in their article, an analysis of organ donation policy in the United States on web.a.epscohost.com dated May 1st, 2016, that these countries have consistent rates of over 85% of donors. Specifically, Austria has 99.98% of their population as donors. Another way to increase the number of donors in the U.S. is to give priority to certain people on the waiting list. For example, donors or their loved ones could be higher up on the transplant list if they ever end up on one. Another incentive that has been thought of is paying people to donate. An organ market could be created and legalized in the U.S. The prices would be monitored and set, and it would be done professionally. Donors would know the rights and could opt out at any time. Finally, there are a bunch of little programs and solutions that are in the works or already put into place. There have been advancements in medicine that could increase the number of organs saved from people who die suddenly. Also, websites like matchdonors.com allow individuals to match with each other, and billboards have been used by patients looking for donors. Public education and awareness are something that are already in place, but there needs to be more to reach a bigger audience. This education would include why organs are in need right now, benefits and risks of donation, and differences in living versus deceased donors. One U.S. program that is currently in place and is a good program is the indication of donor status on driver's licenses. These solutions need to be implemented in the U.S. to raise the number of donors. Overall, the organ shortage crisis is still going on in the U.S. today, and there doesn't seem to be an end to it soon. Hopefully, these solutions can be implemented to raise the number of donors in the U.S. and put an end to the crisis. After listening to my speech, I ask you to please go and become an organ donor so you can possibly save someone's life one day and help turn around the organ shortage crisis. Thank you.